Hey guys, thanks for coming out to see our live YouTube here on the evening before 4th of July, which is a big deal here in America. And I guess in other countries you understand what your Independence Day is like and how it's a big deal. Thought that today we would have your questions, and we already have people coming in. We have Max Volman saying hi, and Max, go ahead and tell us where you're from. Norman Yerham from, oh, it doesn't say where you're from, but you're saying hi, hello. And what up from Nud Crab Walking, which I'm not sure what that is, but I'm glad that you're able to join us and greet us. You will hear the firecrackers going off because it is, you know, the day off before the 4th of July, so all the neighbors are firing things off. Hi, Bianca Dye, good to have you here. Claire and Barney Dog, good to have you here too. Nud Walking is from Michigan. Okay, thanks. Samantha Bravald, hi. We're live. And from Halifax, Nova Scotia, Bianca Dye, happy 4th to you also. Ian Clement, good day from Sydney. Yes, good day to you also, all the way in Australia. Wow. From Texas, Aisha Almari from Abu Dhabi. Wow, I don't even know what time it would be there. Regina, hi, Regina. Cold Spider, hello from Australia. Samantha Bravo from Michigan. Linda Watson from Pinellas Park, Florida. Bianca Dye, it's after midnight, so already the 4th for Bianca. So I hope that you're able to enjoy it. And I didn't give a specific topic for us this evening, so you guys can ask questions. And Samantha Barwell, I know you like the earwax videos. That's why we gave you one, was it today? No, Friday. Subscribe for the earwax removal. Liz Events, hi from Central Illinois. Dr. Gwaine is here. Hello, Dr. Gwaine. Aww. Excellent post. In fact, his being here reminds me I need to tell all of you to go to drgreenknight.com and read his post for today on intercessory prayer. Aisha Al-Amari, it's 5:30 a.m. in Abu Dhabi. Wow, already in the morning out there. And Regina, you need more cysts. You like cysts. Ian Clement has it at 11:50 Tuesday on the 4th of July. And Bianca, earwax videos are really good. Dr. Gwayne's thanking me for the shout out. I think it's a really good photo for today's blog post. I think there should be a photo credit. It was so good. That's my opinion on the photo credit for Dr. Gwayne's post for today. And if any of you read it, please do comment on it. We can talk about that this evening also. Leda 131, love you, Doc. Love you too, Leda. Samantha Bellerveld, oh, thanks. Coral Spider 93, I have a medical question. Here we go, first medical question of the evening. Of course, you can break through all of the comments with a super chat. If you hit that little $sign, I'll definitely get to your thing. But here, Coral Spider is our first one with the medical question. So it is, what is the best thing to treat scanning tattoos and ear piercings that still peel? That sounds like a good question for a dermatologist. And Dr. Gwayne, pipe in if you have any suggestions for scanning tattoos and ear piercings that still peel. I guess the first thing that comes to mind is you might be having some kind of allergic reaction to dye from a tattoo or from the posts that you use for earrings. Of course, it seems that people do the best with gold. We have the fewest, it seems like the fewest skin sensitivities to gold. So using, and if what you have is supposed to be gold, get one that's higher as far as the number of carats, the purity of the gold. And we have some people that won't do well unless they have something above 14 karat gold as far as irritation on the ears. That's probably as far as I'm going to get with the that question. Not being a dermatologist, you know. Samantha's telling us that she's subscribed. Regina says yes. Minas Kasui, need a spider bite video. We might talk about spider bites. Of course, Dr. Paul Thomas has a lot of those. And Regina also likes the hematomas. Is it weird that I like earwax videos? No, all of us here like earwax videos. What are you saying? Trinity, I have microdiscectomy. How much pain will I be in immediately after surgery? Hopefully none, because they'll medicate you. More bottle rockets. Microdiscectomy, pain after surgery, how long will it take to back to normal? Well, the surgeon performing it would certainly be in the best position to answer that question for you. My guess would be for a microdiscectomy that it's going to be a number of weeks, even though it's microdiscectomy. Still, it's going to be I hate to say as many as 6 weeks. Leda just did a $5 super chat, so Leda's getting attention. Leda says, hi Doc, love your videos, love the earwax removal, and more cysts, please. Okay, Leda, your message got through to me about more cysts. So it's probably going to have, of course, it totally depends on what walks in the door. That's, you know, if we don't have cysts coming in to be seen, we just don't have any. I suppose we could, you know, go down the street and try to find a homeless guy that has a cyst somewhere on him to make sure we have one for you. But really, it depends on what comes through. Certainly, I try to get all the cysts on video if I can. Dr. Gwayne, who's happy about us getting a super chat, he can help out by not just going ahead and doing the cysts, but grabbing somebody who can get a camera, but we've been so busy. So I know that when he hears me say that, he knows we've been really busy. In fact, he's covering for me right now on the phone and in the office this week. So it's hard for me to say, make sure you get somebody, because he's just keeping up with all the volume we have until Jennifer gets back from maternity leave. Leda's asking, do you do tonsil stones? In the office, we haven't, although not to say that we wouldn't. We don't have suction, and I'd prefer to have suction when dealing with those because of the airway being right there. And I think Dr. Gwen would agree with that too. What about dog bites? You know, our patient population does not get a whole lot of dog bites. I mean, we get some. And of course, dog bites, we quite often will go ahead and prophylax those with antibiotics, certainly if they're in the hands, but if it's in the face, not always. And we don't like to close those. Again, if it's in the face, we're a little more likely to close it than if it's on a hand. For some reason, those are the two parts of the body I think of when I think of dog bites. They're kind of the opposite of each other. Knowing Reicham, and I'm sorry if I pronounce your names weird when there's a whole lot of consonants together, or if you have numbers in the middle of it. I have a question for you. Do you ever gag while doing videos? Not during the videos, no. Procedures that would make me gag are things that we probably wouldn't be able to put on YouTube. I'll just say it that way. Oh, scabbing tattoos. Keep them moist, absolutely. Keep them moist after you get the tattoo. Keep that ointment on it that the tattoo artist is probably telling you to keep on it. Until it gets healing. And again, your body can have a reaction to the dye and it can be awful. Coral Spider 93 and the ear piercing, I moved it from stud to hoop so it has some breathe space around it. Again, gold, 24 karat gold if you can. Leda 131, if a human ate pus, would it taste like? Well, a lot of people know what pus tastes like because they've had abscesses, dental abscesses, or well, pretty much dental abscesses are the most common one you're going to have where somebody's actually going to swallow. And it's not going to be too different from when somebody has a bacterial sinus infection. If you've ever had a really bad cold and super sopped in, congested sinuses, and there's a horrible sick taste, and you have colored discharge that you're coughing up, or yeah, even just the colored, you know, gray, green mucus you're coughing up with bad bronchial infections, that's going to be essentially what pus is. Do I like my job? Yes, I do like my job, Samantha. Thank you for asking. Linda Watson, tastes yucky. Teresa D. Hi, Doc, from Winnie, Texas. Glad to be here. Minus Kasai. Think there's some trolling you, Doc. Tell me who you think, and we'll look at them. Watch the dental abscess video. He drank some pieces. Yeah, so you can just see someone drinking it right there on the dental abscess video that Dr. Gwain did. Thank you, Dr. Gwain, for doing that. We really appreciate you doing that procedure. Liz Everts, he said, concerning I had retinal pictures taken at the eye exam, don't want to panic. Love the videos. You're such a down-to-earth guy. Dr. Gwain, pus. Why are you writing that? Why are you misspelling it? I'm not going to, okay, I think somebody is trolling me. I think it's Dr. Gwain. I'm not going to go after your bait there. Nude crab walking. Medical question. I just blew my thumb off lighting some fireworks. What should I do now? Oh, hey, look here. Here is my father-in-law, Ron. Everybody say hi to my father-in-law. Tell him what a great guy he is. Dr. Gwain thinks that's nice. Coral Spider. It takes a while for the comments to catch up with what we're doing. Crab Hospital. Claire and Bonnie are, oh, as far as the finger, get it in some plastic. Don't put anything on it. Just get it in the plastic Ziploc and get that on ice, not directly on the part of your thumb you blew off, and get to the emergency department so they can possibly reattach it. They may not be able to. They may just rongeur the bone down and sew it back over. Gwain's family says hi. Gwain's family says hi. Are there any superficial lymph nodes in the upper chest below the clavicle that could be felt if they are large? More likely above the clavicle, below the clavicle? You know what? I don't ever remember being able to feel any lymph nodes from the outside below the clavicle, just above. Not to say there aren't. Leda's giving you hearts, 4 purple hearts. Ella Ritchie, how dangerous are mosquito bites? Mosquito bites can be awfully dangerous if you're in an area with malaria or with dengue fever. Is yellow fever mosquito? No, I don't think it is. Also, we have a problem with, just in areas around the United States, things, well, in some parts, Zika virus, which is especially a problem for pregnant women. It's also sexually transmitted, so if... in West Nile, thank you, West Nile, which actually, of all things, in Nebraska is where they had a lot of fatalities. Just last time I looked at the numbers, not sure why. It's not a huge population compared to other states, but they really had the West Nile in Nebraska a couple years ago. Hopefully that's over with. So, you want to keep yourself covered, avoid the bites, and even though people don't like the bug sprays, hey, they work. The DEET containing. Now, a lot of people will use other things like citronella and other products, natural products, and they help some, but if you really want to protect yourself, it's going to be the DEET that's going to give you the most protection. And Teresa D is agreeing with that. Bianca Dye. My daughter has an arachnoid cyst at the side of her head, and she bumped her head the other day. Not good. What do you know about arachnoid cysts? I'm not quite sure how you're going to affect it by bumping the outside, because the arachnoid's inside of the skull. I'm not real knowledgeable on the arachnoid cysts. I don't know them to be much of a problem for many patients who have them, and probably most people, we don't know they have them because you wouldn't know without doing imaging, and the imaging would be done for some other reason because very few people are symptomatic from arachnoid cysts. That's my understanding of it. Why is watching blackhead and cyst removal so relaxing? There's something relaxing about seeing that big old thing come out of an orifice in the body, and this relates to all sorts of activities. Difficult bowel movements, or things stuck in ears, or people picking their nose. There's some kind of pleasure people obtain from getting something out. And apparently people get it from watching videos of it too. Otherwise we wouldn't have 80,000 subscribers. Pour of Weiner, I don't know of any that patients have right now. Of course, whenever I see one, if the patient, seems like they'd be somebody who'd have fun being on the video, I throw out the idea, hey, there's people who like watching this, and if you'd want to show it to them, we can do it. That's pretty much how I present it to them. Norma Jean Green, hi, good to have you here. Bianca Dye, best cure of skin rash. Bentham, again, not sure the equivalent would be. Leda, 131. Leda gets special attention here, of course, this evening. So I have this thing where only at night my throat starts to hurt like it feels like a sore throat. But then as soon as I wake up in the morning, I feel fine. And then all day, it's really weird. Well, oftentimes when you're coming down with something, you'll feel it in the evenings and be fine during the day. So I'd be curious to know if this is kind of a chronic thing that's been going on or if it's just here just lately. Oh, BooBoo Kitty's here. Hi, BooBoo. Very touching blog today, Dr. Gawain. Oh, there, finally some feedback on Dr. Gawain's blog. And BooBoo thought it was very touching. I think the rest of you will get something from it, too. Yes, it does look nice here. I agree, Christina Hartman. It's because of all the work of my father and mother-in-law making this place look as beautiful as it is. That's why it looks nice here. Leda, do you have allergies? Gawain, thanks. Bianca Dye. Hers is right at the side. You can see the bump. She's had MRI scans. They said it's not detrimental, so they're leaving it for now as too invasive to remove it. I can show you her MRI. Actually, you can't on this, but that'd be interesting to see. BooBoo Kitty, not sure. I want to see a satisfying bowel movement. Yeah, we'll try to avoid that on our channel. Nude crab walking. How come you're not drunk yet? Maybe because I don't drink. You may have seen our previous video about 4th of July safety. I was kind of coming down on people drinking or being drunk while being in the water, operating watercraft, swimming, jumping into water, fireworks. Very much alcohol and fireworks do not mix. His sibling, yes, Dr. Gawain is terrific. Oh, thank you, sibling, for looking at his blog post. Linda Watson, neither do I, BooBoo. Minus Katsua, got to go and watch some Redneck. Okay, you go watch some Redneck. Susan Gamble did by spray, I still get bitten alive. Redneck tooth removal. Oh, that sounds interesting. Not sure if I can spend a private message. Regina Scaffold, I hate mosquito bites. Yes, I agree. And if you look just right over here, when the messages aren't coming up, you'll see a boat going by. Although it's not nearly as entertaining as the boat parade that we had the other night. That was quite something. So, we did have a good question this time. That was pretty good. Let me go back again and look at that super chat just to give one more little polish off that great topic. And it was more cysts, please. Just want to remind myself it was more cysts, please. I make the whole thing shake when I move the thing. So people who are watching this after the fact, it might be confusing to them because this is a live video. If you want to see live videos, there's instructions in the description. No, there aren't in the description of this one, but we'll try to get you some instructions for it. You have to hit the little bell icon on the Auburn Medical Group channel on your YouTube page, and then you can get notified when we do go live and set your settings so that that'll work. And another question here. We have Bianca Dye saying, why are some people prone to being bitten and some aren't? I really get bitten, but my kids seem to attract anything that bites. Yes, there are differences from person to person based on your body's chemistry, maybe even based on your respiratory rate. That I'm just guessing because I've heard that they're attracted to carbon dioxide. Haven't read about that, at least not lately, so don't quote me on that one. Jazzy Andrews, what's the best advice to clear polycystic ovary syndrome and to fix my open bite mouth problems? And can I get a shout out? Howdy, Jazzy Andrews, shout out. Well, there is no magic cure to polycystic ovaries. There are treatments for it, nor is there to open bite mouth. That's hard to correct, can be helped sometimes with prosthetics, braces, oftentimes surgery. Those aren't things you're going to be able to just make go away. I met my tooth and jaw problems. Again, it would be a dentist for that. And Regina is saying that it's only the females that bite, going back to the mosquito question. Bianca Dye, contraceptive pill helped my PCOS. Yeah, again, no cure, but contraceptives, and some people, because of elevated blood sugars, will take a medicine called metformin. His sibling, I used to get bitten a lot, but for the past 15 years or so, no bites. I think the bugs don't like the way I taste from my meds. That could be. I'm not going to argue against that. Thank you so much, guys, for making this a very successful live YouTube with your questions. Nude crab walking. My private part is only... okay. I think nude crab walking is going to be put in timeout. Put user in timeout. There we go. Okay, so the rest of you, though, thank you so much. Until next time, Dr. Mark Vaughan telling all of you to stay in good health.